Well, hello and welcome to Ask the Doctor. My name's Jerry McGee and I'll be the host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you for your time. On today's episode, Doc, we want to talk about a problem called trigger finger.
Yes.
Okay, now, a lot of people watching this show, such as myself, might be a hunter, like to go out there and hunt. I've been known to have trigger finger, but just if you could let us know, that's two different things, correct?
This is true.
So what could you tell us that, like basically what is trigger finger?
My understanding, it's usually from repetitive stress. What happens is the fingers can't open and close properly. What happens, there's a clicking and a snapping, and it can be very painful, okay? And it's usually from repetitive stress, and it's a very painful thing, and a lot of times they either want to do surgery or they want to inject you with cortisone, and we got something better, Jerry. That's the good news.
Now, if a person is dealing with trigger finger right now, what might be some signs or symptoms that they could look out for that, maybe kind of...
They're very stiff in the morning. It's inflamed, it's red, okay, it's painful, they're having trouble moving it, opening and closing the hand, they open the hand, they can't close it, or vice versa, they can't open it completely, and they can't use their hand properly, okay? If you want to open a car door, I know people that come in, they say they can't open a car door, and if you can help them open a car door, hey, you don't need the shot, you don't need the surgery.
Right.
So yeah.
And sometimes those... we take some of these simple things for granted, but when you have that problem, it can really affect your overall lifestyle.
Yes.
Now, from a cause standpoint, and I know a lot of times, a lot of the videos we talk about could be related to some work-related things. What are some causes, or even from the research I did, was there's even some things that we deal with that kind of predispose us to these types of problems. What can you tell us about that?
If you have rheumatoid arthritis, if you're a diabetic, if you're hypothyroid, those kind of people, also women, are more at risk. But we have men too that come in and they're using power tools, they're doing repetitive stress. I have people, they're opening up jars, they put too much force in, and opening up a jar sometimes that can traumatize your hand. Okay, I had another patient, he was in an auto accident and the airbag actually hit his thumb. So it could have hit any finger, it happened to hit his thumb, and that was a very painful thing. He came, we were able to help him, and we can tell you in a minute how we did that. But basically they wanted to inject him with cortisone, they wanted to do surgery. Okay, and we were able to do other procedures what we can talk about, and he was able to avoid the surgery.
And again, it gets back to, before surgery, we always recommend exhausting every option. So if a person came here with trigger finger, what types of treatments do you do, and how does that work?
My experience here, we do anything and everything to exhaust all our conservative options. Okay, we're doing this new procedure called Impulse, which is 100 times faster than human hand. We get in there, and what that does, Jerry, just to keep it simple, it stimulates the mechanoreceptors in your brain, which modulates your pain, increases the range of motion. We can actually adjust the joint, okay? We can do physical therapy. We have a massage therapist. She can get in there and massage the trigger points, okay? We can do acupuncture in there, non-invasive acupuncture with certain acupuncture points on the hand. And the bottom line, Jerry, it's all good, it all works. Like I say, back to the original rule of thumb, if they're 40% better after 3 weeks, I'm happy, they're happy.
Right.
They're on the road back to recovery. They're opening their car door better. They're opening up Skippy jars. They're not as stiff in the morning. They're able to open and close their hand. They're not in pain. They're not taking medication. It's all good, it all works.
So if they're dealing with this right now, and I think a lot of times that the approach is going to be to take a drug to mask the pain and keep doing what you're doing.
So when the drug wears off, they still have the problem.
Right, but they're almost just beating that problem with a hammer and wondering why it doesn't ever go away.
Right.
Now, you really got to get back to the cause of it, treat that, and stop taking this approach to mask the pain.
My understanding, the only way that a hammer would help if that was a nail. So if you're a nail and you use a hammer, God bless you. But see, in our toolbox, Jerry, I don't know if you ever heard this, we have a hammer, we have a Phillips, a screwdriver, a wrench, and a blowtorch. So we have 5, 6 different options. We're not just going to hammer the nail, because it's more than that. It's not one cause, one cure. It's many causes, many cures. So in our toolbox, we use all our tools. We don't just use a hammer.
Yeah. And I think the big thing is that people have to understand that early intervention is important. Okay? You don't want to keep aggravating, that problem. Don't get to the point where a lot of people say, well, I'm just going to deal with it. It'll go away.
It's going to get worse.
Right. I mean, this constant irritation, it's never going to improve. And it might down the road, who knows, get to the point where surgery is your only option.
Because it's permanent. They've done permanent damage.
But if they had taken that step early and said, okay, listen, let's get some preventative medicine done here. Let's look at chiropractic. Let's get in there and kind of fix it early. The results are going to be much greater than if you just let this go on.
Everybody in our audience, of course, has been to a dentist. You may not have been to a chiropractor, but we're kind of like we're dentists for the spine, but basically if you had a cavity in the dental office and the dentist gave the option, you want to fix it now as a cavity or you want it to get worse and then in 6 weeks I'll do the root canal, what would you do?
Yeah. Oh, you want to fix it right now.
That's how we are.
And that's an interesting concept because I don't think a lot of people today understand that approach. You know, like you said, we do go to a dentist. You know, we try to get there, you know, every 6 months or whatever they want you to go, get your eyes examined, you know, once a year, whatever, to make sure that's going well. But they don't think about probably the most important thing.
Which is your brain and your spinal cord, which is
Right,
your central
right.
nervous system, which is your master system of the body, which controls every cell and organ and muscle of your body. So
Yeah.
to me, Jerry, it's a no-brainer.
Yeah. Yeah, the one thing that could really have an impact on everything, we don't do any preventative medicine or preventative work with. You know, and I think as you're watching this, I mean, that's really what we want to stress, as you can, you know, see from a lot of our videos, is that, you know, you have to, it's not only about waiting till you have a problem to treat something. Let's look at trying to prevent the problem and get into an early program and maybe, you know, you get adjusted once a month or, you know.
At least. I mean, chiropractic is now 116 years old. It started in 1895, okay? And the reason we're still here, Jerry, is because what we do works. The public has demanded us as an opportunity, as an alternative to just drugs and surgery. So the bottom line is what we do works. It's a science. See, my definition of a science, Jerry, if something works, it's a science. What we do, it works.
Right, right. And I think that's, you know, that's really the most important thing you can take from all of these topics, you know, is that you want to get, you know, early intervention, you want to work on preventative medicine, and when you do those things early on and look at your lifestyle, look at your nutrition, look at everything involved in your life, if you make those changes, you can live a great, you know, long, happy life that doesn't, you know, you're not walking around like zombies like a lot of these people we see.
You know how a computer has a default setting? Our body has a default setting. You know what it is? Health and wellness. We're not supposed to be sick. We're not supposed to be in pain, Jerry. How do I know? Because I'm not sick and I'm not in pain. Why? Because I get the care.
Yeah.
Okay? Try 39 years of chiropractic.
But how many people today, unfortunately, are walking around? You know, I think that the problem is they felt bad for so long, they don't even know what it feels like to feel good.
That's exactly right. Let's say the first time you put your glasses, I remember the first time I put my glasses on, I was a junior in college. And I put my glasses on and I looked out. I said, that's the world?
Yeah.
That's what I've been missing? Okay? And that's how it is. It's like, you don't know what it's like to feel good.
Yeah.
Okay, I feel so good that if something's not right, Jerry, you know what I want to do? I want to get it right.
Right, right. Yeah, so if you're, you know, if you're watching this video today and you're like that, you're, you know, whether you've got this problem we're talking about today or you're just walking around low in energy, just kind of, you got the blahs all the time, you're, you know, aches and pains, and, you know, you get up in the morning and you're just not looking forward to the day, then that's the time when you've got to say, okay, today's the day I'm going to make a change. Pick up the phone, call Dr. Goldberg down here at Wellness Associates. He offers a great thing, and that's for every new patient, you get a free evaluation, so you can meet Dr. Goldberg, kind of pick his brain a little bit, look at you know, at where you're at right now, get a good baseline, and he'll set you up on a great program that can help with a specific problem that you have, or get you set up on a preventative program to really kind of help you achieve that life and get back to that point where, you know, it's like putting on those new glasses and all of a sudden the world just looks like a different place. And people will start to ask you, you know, well, what are you smiling about? You know, why are you bouncing around? You seem like you got another hop in your step. You know, that's because you're treating your body the way it needs to. You're practicing great preventative medicine, and the body does great things if you do that. So with that, we'd like to thank you for watching our video today. We hope you find all of our videos to be educational and informative. If you have a specific problem that you would like us to address, feel free to visit our website at AskDrGoldberg.com, and you can click on Ask the Doctor. You can send us your question. We'll be glad to feature it on one of our upcoming episodes. So with that, thank you very much for being part of what we're trying to accomplish here and just educating the population on the benefits of chiropractic care and all the alternative forms of medicine that are out there. And we look forward to seeing you on future episodes, and be sure to check back often for, you know, some great new topics that will be coming down the pike. So thank you very much for watching. We'll see you on future episodes.